Well, diabetes is a problem that most Indians suffer with. Also obesity. And we're now in an era that has new drugs, things like Ozempic, Mounjaro. We have bariatric surgery. And still we have a lot of people who tell you that maybe you just don't have enough self-control. You should stop eating. You should walk more. You'll lose the weight. Is obesity really a disease like diabetes? Can it be solved with surgery? Is there a surgery that actually treats diabetes? These are the questions that we're now asking. And we have an expert to answer those questions for us. Dr. Ramen Goel has spent 35 years pioneering bariatric metabolic surgery in India. He is the editor of the Journal of Bariatric Surgery, and he leads a team at the hospital he works at that actually treats diabetes with surgery. He's going to talk to us about all of these things. Doctor, thank you so much.
Thank you.
For making time to talk to me. Can diabetes be solved with a surgery? Is that possible? It seems, it seems very different from everything we've heard so far.
So medicines have been around for diabetes for over 100 years. 1921, insulin was first identified. Before that, there were no medicines. So thousands of years people lived with diabetes, died with diabetes without medicines. But even with 100 years of medical management of diabetes, let's say in India, 77% of diabetic patients are uncontrolled. Surgery, if done, 90% of patients will remain controlled diabetics even for 10 years. So on one side, you have almost 80% patients who are on medicines but are not able to achieve good control. On the other side, we have 90% patients who will have surgery. If they have surgery, they will remain controlled diabetic even after 10 years. So the odds are extremely in favor of surgery. Only thing it's a surgery, it's not a pill that you take.
So when you say they will remain in control, you're saying for the 10 years at least after doing this surgery, they don't have to take medication and their diabetes, their blood sugar levels will be normal.
No, I never said they don't have to take medicines. These are all cumulative. It's a lifetime disease, diabetes also. So those who come early for surgery, that let's say those who come in first 5 years, they will probably never require medicines.
Okay.
Those who come before diabetes has come, like those who are pre-diabetic, they will not become diabetic. But those who come late, let's say somebody has diabetes for 20 years, they are on insulin for 10 years, they may still need medicine. But the challenge is these people who have been on insulin, they are uncontrolled. Their HbA1c is 9, 11, 13. And they are just helpless. I mean, these are not, I'm not talking of illiterate people. I'm talking of highly educated, corporate people, doctors themselves, who know everything, they're doing everything, and still the sugars are out of control. For them, surgery is a very good option. One-time surgery, it's a keyhole surgery, and they can remain controlled diabetic for rest of life. The controlled diabetic is not about blood sugar alone. It's about the complications of diabetes. We can keep on talking about them, like kidney failures, heart attacks, brain strokes, people losing their limbs. Okay, I have seen people working in resorts like a waiter who is diabetic. And he can't afford insulin that is prescribed to him, so he doesn't take it on a daily basis. And then his lower limb is amputated. So if he loses his lower limb, he cannot work as a waiter anymore. So it's a disease which goes across financial status, across education, because the medicines do not treat the primary cause of diabetes.
Which is?
Which is insulin resistance. Okay. So we have two types of diabetes. One is type 1, which comes from childhood, where pancreas are not working. So that's a separate group. We are talking of adult diabetes, where body is producing insulin, but it's not working because there is a blob, there is a sort of insulin resistance. Now, most of the medicines do not treat that. They simply try to control blood sugar. So one medicine produces more insulin, one medicine tries to push the sugar in urine. So they're trying to bring down the sugar without treating the primary cause. It's like treating somebody with malaria with paracetamol without giving them quinine kind of things. So the temperature is down, but malaria is festering.
Yes.
Same thing is here. The diabetes remains there. The insulin resistance remains there. Sugars are partially controlled. With surgery, we are targeting insulin resistance.
What happens in this diabetes surgery? What do you actually do, and how does it control insulin resistance?
So when we do diabetes surgeries, which are more commonly known as bariatric or metabolic surgery, they are the same. They are all interchangeable terms. They are the same. What we are doing is we are rewiring the intestines. So the food goes in the stomach and goes in the intestine faster.
Okay.
Because of which the intestinal hormones like GLP-1, PYY, GIP, amylin, multiple hormones are produced in different concentrations or different levels. And because of this, the insulin resistance goes down. So the person becomes almost like a non-diabetic. I'm not saying that diabetes goes away, but the person starts responding like how when I eat a meal, why my sugar remains controlled? Because I'm non-diabetic. Those hormones are produced early and they control the blood sugar. But in a diabetic, that doesn't happen. Those hormones are produced late or they are produced in less quantity. When we do the surgery, we try to bring them almost at the same level as a non-diabetic. So their hormones are produced early, they are produced in higher concentration, and because of that, the insulin resistance goes down.
And so what is a sleeve gastrectomy?
Sleeve gastrectomy is where we chop off part of the stomach.
Okay.
We don't bypass. Okay. So we reduce the stomach capacity by removing part of the stomach. Now in this case also diabetes improves because when we do it, the food goes out of the stomach faster and it stimulates the hormone secretion. So whether we do sleeve gastrectomy or whether we do bypass, the control of blood sugar is equally good.
Who qualifies for this surgery?
International criteria and international Indian criteria are the same. Anybody with 27.5 BMI and uncontrolled diabetic, uncontrolled type 2 diabetes. Okay, too many things. So 27.5 BMI is somebody who is at least 8 to 10 kg overweight.
About 10 kgs overweight.
About 10 kg overweight. And has to be type 2 diabetes, so we cannot offer it to children with diabetes who are taking insulin. And those who are uncontrolled, whose HbA1c is at least 7.
So it's interesting to me because normally the approach that we take to surgery, at least in India, is have you tried to alter your lifestyle? Have you tried the medication? When none of it works, then we go to surgery. But it sounds to me like you are suggesting people come earlier for better outcomes.
So we are talking two things, I believe.
Okay.
If you are talking of diabetes,
Yes.
if they come earlier, the outcomes are definitely better. Because as we delay intervention, surgical results are not that great. The sugars will remain under control, but they may still need medicines. Okay. So that is one part of it. The other part is that if sugars remain uncontrolled, let's say for 5 years, person may develop a kidney problem. Person may develop a foot problem. There may be nerve damage in the feet. And that leads to a long-term complications. Those complications do not get reversed. So even if I operate somebody who has been diabetic for 30 years and I operate the person, the sugars will become normal, but the foot problem may not get reversed. The kidney problem may not get reversed. So that's the reason that we are in a situation where we can offer almost a preventive kind of intervention.
There's a view that surgery is invasive. There's a lot of risk. It's better to try and avoid it as much as possible. What are the risks of this surgery?
So there is nobody who can say that surgery doesn't have risks. All right. Obviously, even if you take a pill like a paracetamol, there's a whole long list of. Same thing is with surgery also. There's a long list of what can go wrong.
There are some risks that are standard for most surgeries, which is huge infections and adverse outcomes, which are linked to anesthesia, for example, which would depend on any surgery. But in terms of doing this bariatric surgery for the control of diabetes, what are the long-term, adverse outcomes that you've dealt with?
Fair. Specifically for a metabolic or a diabetes surgery, when we are reducing the stomach size or when we are doing a rerouting of the intestine, the person cannot get enough nutrition from the small amount of food the person is going to eat after surgery for a duration of first 5 to 6 months for sure. So they need to have certain supplements like protein supplements, vitamin supplements, so that they don't end up with deficiencies. Those supplements are only to reduce possible deficiencies. If they take those supplements, they are not going to have any deficiencies, number one. So when somebody comes and says that, that person is looking so weak,
Hair is falling out.
His skin is looking haggard, it's because of a non-compliance.
Because they're not taking the supplements.
Absolutely.
Because my research says that there are nutritional deficiencies, and so because you've bypassed a portion of the stomach, that absorption is not happening. And so there's a possibility of anemia, osteoporosis, hair loss. The person visibly ages very drastically.
We all know it. These surgeries are in practice for 70 years now.
Yes.
It's not something like a COVID vaccine. This has been there for a long time. Scientifically studied, extensively published. So we all know what can go wrong. And for everything there is a answer. And it's a defined protocol. Now the problem is 80% of patients will follow the protocol, 20% will follow what is being told by their neighbors or by a social media post. That's where things can go wrong.
I would also talk to you about using this surgery to treat obesity.
Yeah.
Which we've all understood bariatric surgery to be about, treating obesity or chronic obesity. You're now using it for diabetes as well. We have an issue. We have 8 crore Indians who have diabetes in India. I don't know what the number is specifically with obesity, but I understand it is among the highest in the world at this point and growing. Who do you believe, non-diabetic, qualifies for bariatric surgery?
So somewhere in 22, the guidelines got changed worldwide. So anybody with 35 BMI, even if the person has no other disease other than obesity, qualifies. Now 35 BMI is somewhere who is about 25 kg overweight. Anybody with 30 BMI with any other disease like blood pressure, diabetes, or sleep apnea, or PCOS, or somebody who is unhappy with his quality of life. Quality of life is also a disease, if somebody is unhappy about it, can also have this surgery. So 30 BMI is somebody who is like 15 kg overweight, approximately.
Do you believe obesity is a disease?
100%.
What causes obesity in your opinion?
So obesity is a disease because we know it, because this is genetic. It runs in families. It runs in my family also. So if a grandmother or a grandfather or a granduncle was having a trait of obesity, then it may come to second generation, third generation. So one is, we know that this is seen in families. Second thing that we know is that there are people who eat, let's say, just for example, say 5 chapatis a meal and they are bone thin. And majority of my patients eat 2 chapatis a meal and they are not able to lose weight, okay, or they are gaining weight. So that itself says that there is something beyond eating and beyond exercising. So scientifically speaking, about 70% contribution is genetic and about 30% is environmental. Now, environmental means not only that you are eating more or exercising less, it could be many other things. It could be that you are in a profession where you, like I have marketing colleagues of my hospital who have to eat at least one meal or two meal outside every day.
Yeah.
They can't control the calories that go through it. There are people who are on certain drugs like steroids, those who are taking psychiatric medication. They all increase hunger and they all lead to weight gain. So there are multiple environmental issues which are beyond control of an individual. It's not just the willpower.
So the idea that people tell you that, oh, you're just overweight because you don't have self-control, or you're not able to like resist that dessert, or you're not active enough, you disagree with this. You're telling me that 70% of the people who are overweight are genetically predisposed to being overweight, and it doesn't matter what they do, they will be in that battle with their bodies for the rest of their lives.
So those who say these things that, you're not exercising enough or we are not eating healthy enough are ignorant people. Just forgive them. They don't know what they're doing. Because if you analyze statistically, patients with obesity exercise more than those without obesity. It's just a perception that, I am thin because I exercise. That's wrong. You are thin because you are blessed with a kind of gene that makes you not gain weight. Same thing applies on food. Patients with obesity have been trying to avoid unhealthy food for years, decades, and still they are not able to lose weight. But the problem is they are under scrutiny. When a person with obesity goes to a restaurant, so I'm talking of the person with morbid obesity or very with a large body, goes to a restaurant, everybody is watching what he or she is eating, while they are themselves not seeing how many desserts they had themselves or how unhealthy they are eating themselves. So I think it's a societal issue. There's a prejudice or there's a stigma about obesity. And the only reason why it's so manifest in obesity because diagnosis is written on the body. Unlike any other disease.
Tell me about the GLP-1 drugs that we now have, Ozempic, Mounjaro, which are now being used a lot to treat obesity as well, not just diabetes. Do you believe that they can be a replacement for bariatric surgery? Do they complement bariatric surgery? How do they change the landscape?
I think introduction of GLP-1 drugs is a game changer in obesity management.
Okay.
Because we had a cap. On one side, we had diet and exercise, lifestyle changes. On the other side, we had bariatric surgery. There was nothing in between. Now the whole spectrum of intervention is available to a doctor. GLP-1 drugs are good for weight loss. Obviously, they are good for diabetes, but they're good for weight loss. And they complement lifestyle changes. They also complement bariatric surgery because they are for a different set of patients. So we have patients who are, or persons who have gained, let's say, 8-10 kgs. Somebody gains weight during pregnancy, 8-10 kgs. Now she wants to lose weight after delivery. She doesn't need medicine. She doesn't need surgery. She goes on a diet. She can lose weight. Nobody will tell them to have a surgery. Now we have somebody who is, let's say, 10-15 kgs overweight and wants to lose 5-7 kgs. That person can do very well with GLP-1 because they can lose weight and maybe maintain it long term. When we talk of surgery, we are talking of patients who are at least 25-30 kg overweight. Now, even if we put them on GLP-1 drug, they will lose 10-11% of the weight. So all these drugs are talking of weight loss of 15-25%. But in real life data that has come out of USA, where this is available for almost 3 years now, shows that the weight loss is about 10-11% on an average. So if somebody who is, let's say, 100 kgs is put on a GLP-1 is likely to lose 10-11 kg, still will remain a surgical patient. This person will not lose more weight just because they continue to take medicines. The medicines have a limitation in terms of percentage of weight loss. So somehow the perception has happened that, you keep taking medicine and you will lose more weight. No, you keep taking medicines so that you maintain the weight that you
have lost.
So if you lost 11 kgs, by taking medicines lifelong, you can be off that 11 kgs for a long time.
So Ozempic and Mounjaro can help you lose a certain amount of weight, but if once you get off that drug, you're saying the weight will come back.
Yeah. So one thing is Ozempic is not approved for weight loss.
Okay.
Mounjaro is approved for weight loss and Wegovy is approved for weight loss, which is just like Ozempic but different. Now, these medicines are lifelong medication. These are not short-term medication that you take it for 3 months or 6 months, you lost weight and then you can stop it. Because all the clinical trials have shown that when you stop medicine, you rapidly start gaining back.
Okay.
How much you will gain back is a matter of debate because these are clinical trial data. So they follow till a certain period and they stop following the patients. But in real terms, as we are aware for last so many years, that if you stop an intervention, it's like you go on a diet for 6 months and you stop your diet after 6 months, you start eating everything.
It'll just come back.
It will just come back. Same thing will happen with medicine also.
So effectively, what you're saying is that someone who has obesity, who is predisposed to gaining weight genetically, which is what most people who are overweight are, they can diet, they can do the lifestyle change, they can take the Mounjaro as well. But these are all temporary solutions. Unless you do it lifelong, the weight will come back.
Yeah. So what has happened is that this realization has settled in that obesity is a lifetime disease. We have been saying it's a lifestyle disease. It's a lifetime disease. So that's number one. Number two is about 10 years back in US, this realization also came in that battle of bulge is lost. By just going on a diet and exercising, people are not able to maintain their weight. They can lose weight, but it keeps coming back. In more than 90% patients, the weight will come back, whatever they do. So they need help. And help has come in the way of medicine. Obviously, everybody cannot have surgery, should not have surgery. So even though I'm a surgeon, I'll say that surgery is for certain set of patients. But what about millions and millions of people who are gaining weight and who are suffering from obesity-related health problems? So for them, medicine is a good solution. They are expensive at the moment, but they will become economical over a period of time. Okay. We all know that. But they have to be taken lifelong, for sure. There is no substitute.
Can the body withstand or can the body handle GLP-1 drugs for a long term?
Why not?
Okay.
GLP-1 as a group has been around for a long time. As other molecule, not the ones that you are talking about, semaglutide or tirzepatide. There have been other similar molecules for diabetes for a long time. But they were not discussed publicly because they did not have that much weight loss. The excitement has built up because of the weight loss that is coming with these new molecules.
And in your opinion, is this likely to improve as well? Because there's research on right now to improve even the Mounjaro that is currently available?
Yes. So we are doing a clinical trial on the part of global trial where we are doing on a molecule which is beyond what the Mounjaro is chemical name is tirzepatide. Now we are coming with retatrutide. The same company is coming, and there are other molecules.
What will that do?
It's same, but it has 3 hormones.
Okay.
So semaglutide has 1 hormone that you call as Ozempic or Wegovy. Yes. The Mounjaro has 2 hormones, GLP-1 and GIP, and the third one will be triple hormone. So that is likely to lead to better weight loss and better diabetes control. So I think once these drugs have come, we can always only improve from here, because they are also knowing what are the side effects that people are feeling. So they are trying to reduce the side effects, and they're also trying to improve the efficacy of it.
There's a lot of people who will just say, let me just wait until this whole system improves. Because right now we understand Ozempic is facing $2 billion in lawsuits for side effects that people did not know that they would be facing, things like blindness.
Let's talk of side effects, because these are the issues which I also see in social media. That
Yes.
I believe the companies also see it in social media. So there are side effects which are related to drug. There are side effects which are related to weight loss, and there are side effects which are related to sugar control. These are three different things. Why I'm not defending medicines, but we have seen this with bariatric surgery. So effectively, the pharmaceutical industry benefit from our inherited knowledge. So let's say if somebody is diabetic and has an eye problem already, and that person's sugar is rapidly controlled, either with medicine or with surgery, there is a possibility that person can have a vision loss. Okay. So this is because of rapid and good control of diabetes in a person with pre-existing eye problem. Now, why this is being reported and why lawsuits are being filed? Because these medicines have almost become a over-the-counter kind of thing. Everybody is taking it even without prescription. Now, that has to be discouraged. If the same person had gone to a good qualified doctor, he would have said, you are already diabetic, you already have an eye problem. I think you should get an eye checkup done first before we put on GLP-1. Now, this person starts because somebody gives a prescription or without prescription gives the medicine, you should take it, and ends up with vision loss and files a lawsuit. So this is one part of it. Diabetes control itself, rapid control of blood sugar can itself cause side effects.
Okay.
Second thing is the weight loss. Now, when rapid weight loss happens, it's possible that somebody forms gallbladder stones. We know it. We are aware. That's what I was saying. We surgeons knew it for last 70 years.
Yeah, kidney stones, gallbladder stones.
Gallbladder stones primarily.
Okay.
So we give them a bile salt that they don't form gallstones in first 6 months after bariatric surgery. We do the same thing when the patient comes to us for GLP-1, because we know the gallstones can form. But these kind of advisories have not come from pharma industry for whatever reason. So the support system around weight loss is missing at the moment for the pharmaceutical product. The way it has been built around bariatric surgery over the last 70 years, it has not started building up for pharmaceutical, which should come. But then it's a side effect of rapid and substantial weight loss. It's not a side effect of pharmaceutical product.
Okay. So anything that causes rapid and substantial weight loss will have these
May have this.
side
Gallstone
effects. So
formation.
whether you lose the weight by taking the GLP-1 drugs or you lose the weight by bariatric surgery, there are some side effects that are likely to happen, including vision loss, gallstones, and so there are ways to mitigate that, is what you're saying.
Absolutely. I am not saying this is a side effect of procedure. It's a side effect of control
weight
of a disease. If there is any medicine which can control blood sugar like this, there is a possibility of vision loss. So the sugar control should be gradual. Same thing is weight loss should be gradual. But these are very effective intervention, whether it's surgery or GLP-1. So instead of saying that we do gradual, we should mitigate it, as you rightly put it. We should have the support system to tell patient, you're going to lose this much of weight, but I'm giving you a bile salt that you don't form gallstones.
Doc, when we talk about being overweight or being obese and all of the challenges that come with it, so you're now at a risk of heart disease, you're at a risk of high blood pressure, a lot of lifestyle problems. Do you believe when you say obesity is a disease that we don't offer enough social support to someone who is obese? It becomes that person's problem. The onus of the obesity is on the patient, saying that you are not being, disciplined enough to be better.
Other terms we call it stigma. So this is a major problem, and it doesn't come from outsiders. It's from within. I have seen young kids let's say, an 18-year-old girl who is told by her father or a mother, eat less. Parents don't even realize that this poor girl has been eating so less daily, and if one bite she takes extra on a day, it's pointed out. Then she's going to gym for 2 hours in morning, 2 hours in evening, and she's not able to lose weight. Same thing happens in schools. Teachers tell, why don't you exercise? Why do you eat more? Without realizing that the poor child has been doing that for 10 years now. The worst of it is strangers, This child goes to a marriage with her parents. Somebody who is not even related to her walks up to her. Take care of yourself, you have to get married. Without realizing how much social or psychological issue it will cause to that person. I think it's a major problem because people don't realize that it's in the biology of that or physiology of that person who is suffering from this disease. And then over a period of time, what happens, and these are different facets of stigma that comes. This person internalizes that stigma. Let's say if we are talking about a girl, let's say she starts believing that she is not able to deliver weight loss. So if my father is saying this, that means there is something wrong with me. I don't have enough willpower and I can't exercise enough. So when they go to let's say a health farm, lose 15 kgs in 1 month, they come back, they spend lakhs of rupees, and they come back and the weight comes back obviously in next 3 to 6 months. Then the stigma worsens. On one side, she knows that parents have spent this many lakhs for health farm and again she has failed them. Without realizing that she has not failed them, it's her disease which is causing the weight to come. Now the onus is on the person because the food choices are so many. Socially she has to go with her friends to programs, social events, birthdays, marriages, have to go on a vacation, all those things where the normal food is served. Now normal means unhealthy food is served. When the unhealthy food is served, this child will gain more weight without realizing that other 20 children did not gain weight. They also eat the same food, maybe more. So the blame comes, let's see, you did not take care of your food when you went on a vacation. But it's not a question of what she ate or what she did not eat. The primary problem was a disease. So this concept of that we fail on a weekend or we have a cheat day or a cheat meal and that's why the weight has come back is all flawed.
Okay.
At the end of it, you have to accept that this person has a disease. It's like diabetes, it's like blood pressure, it's like a cancer, which is going to be there, it's not going to go away without help. And that is where the intervention has to come. Help is not only dietitian. Dietitians are very important. They give nutritional advice. But now the interventions have to be given either. So if the weight is repeatedly coming back, either a medicine or a bariatric surgery, one of the two.
How much weight have people lost with bariatric surgeries?
Okay.
You've been doing this for 35 years now.
Yeah.
What is your ballpark result?
So typically patients lose about 10% of their weight in first month. So if somebody is 100 kgs, we tell them you will lose between 8 to 12 kgs. If they are 200 kgs, we tell them you will lose between 15 to 25 kgs in first month. And then every month 5 kgs or 5%. So youngsters, when we operate, people who are between, let's say, 15 years to 40 years, younger people, they would lose around 100% of their extra weight.
Okay.
And if I operate on a senior citizen who is 70 years, they will lose around 60 to 70% of their extra weight.
Do they regain that weight at some point?
So we have multiple publications. Our own publication shows that even after 10 years, 80% are maintaining their weight. definitely 15 to 20% do regain. What is the reason for weight regain? We have analyzed 3 reasons. One is alcohol consumption. Alcohol consumption has become rampant in our country. I don't know about other countries much, but so some people start consuming alcohol on a daily basis. Some people start having sweets after every meal. Some people start having the fried stuff, the oil rich stuff. So what we need to realize is that after bariatric surgery, we have not changed the genes of the person. The person still remains Ramen Goel or XYZ. The genetic makeup is still the same. The tendency to gain weight is still the same. Now they have lost all of their extra weight. And if they make right food choices, so these 3 things, alcohol, sugars, the high calorie item and fried items. If they are careful about these 3 things, they can maintain weight. So after bariatric surgery, as I am saying, 80 to 85% patients can maintain their weight long term, even after 10 years. While these patients, 98% of them will regain weight within 1 year if they go only on diet or exercise. So on one side, we have something where relapse is almost 100%. On other side, we have a relapse rate of just about 15%.
The idea that you just talked about, consumption of alcohol and high calorie items, sweets, sugars, fried things. Is this true for all of us? I mean, as a doctor, what is your point of view on consumption of alcohol?
I think alcohol in a very small quantity, or as we call it, moderation, is to certain extent socially acceptable, health-wise also acceptable.
Okay.
In a limited, I am aware of the various things that they should be completely stopped. So between two vices, let's say smoking and alcohol, I'll say smoking is very bad, alcohol is bad. The problem with alcohol is that many people are going overboard. It's so easily available, it is becoming so socially acceptable that even in families, people are drinking every day. So I have no problem if you drink with family maybe once in a fortnight or so. But if somebody is having it every day, it's becoming a problem. And then they end up with multiple issues, liver issues, cancer issues and other issues. So alcohol is a challenge, cannot be completely stopped, but it's so much ingrained now. And one has to be very, very sensitive that we need to restrict it to a certain level.
What does bariatric surgery cost, doctor? And is it covered by insurance?
So bariatric surgery cost varies between different hospitals, between different surgeons, and based on facilities that person utilizes. Fortunately, from 2020, all insurance companies are mandated to cover this. So all insurance companies cover 100% of insurance cost, and it is practically free for those who have insurance. It has been free for all the CGHS workers right from 2011. So central government as early as 15 years back realized the benefits of bariatric surgery for their employees and their dependents. And we have been doing those surgeries free of cost for army personnel, for railway employees, for all the central government employees. Insurance realized it 2020. And incidentally, for obesity management, surgery is the only intervention that insurance covers. They don't pay you to go to a gym, they don't pay you to go to a dietitian, they don't pay you to get medicines, but they pay you for surgery. Why? Because they know the benefit of this surgery to avoid heart attacks, to avoid diabetes, to prolong life. Bariatric surgery, just for weight loss, increases lifespan by about 5.5 years. For diabetes, it increases lifespan by 9 years.
When there is weight loss either through bariatric surgery or the GLP-1, you said that it's possible for the person to use bariatric surgery, through bariatric surgery, lose all of their extra weight. Is there an understanding of how much of that extra weight is muscle weight and how much of it is fat? And does that weaken muscles like the heart?
Excellent. Nobody asked me about this muscle, heart being a muscle. I tell my patients about that. So what we do is before surgery, we do their body composition analysis.
Okay.
We identify what is the percentage of fat and the fat mass, how much is the muscle, and all those things are identified. After surgery, we encourage them to have more proteins and exercise regularly. Now, this is not for weight loss. This is to make sure that they don't lose more muscle. They lose mostly fat. But then advice like this is taken by someone who is exercising and the neighbor say, if he had to exercise so much, he should not have done surgery. He should have done the exercise before surgery, without realizing that he is doing it to become a healthier person. So, in our practice, we say that you should not lose more than 10% of muscles. 90% should be fat loss. And we target that. So, after 6 months, we again do a body composition analysis. Again, after 6 months, we do, and we are able to show you have lost 8% because you are exercising, and somebody has lost 12%. We say, guy, pull up your belts. You need to be, you want to be healthy. You just don't want to lose weight. You also want to be healthy. Because when they lose muscle, they are not losing only their biceps. Heart is also just a bundle of muscle.
Yes.
Now, this is one of the problem when they do lifestyle changes or when they go on GLP-1. There is no support system around that. So, if somebody is rapidly losing weight, they lose up to 20 to 30% muscles. And that is where the problems are likely to come 5 year, 10 year down the line in these patients. This is like typically a yo-yo phenomenon on a diet. You go on a diet, you stop the diet. So when you go on a diet, you lose fat and muscles both. But when you gain back, you gain mostly the fat.
And the muscle is gone.
Muscle is already gone. Again, you go on a diet. Again, you lose little more muscle. Again, you come back. So one should try to do one definite, I'm not saying surgery, one serious attempt on diet and stick to that. But if you keep going to and fro, yo-yoing it, you are actually becoming physically weak with every attempt, even though you are gaining weight. Obesity is a malnourishment. Obesity is a malnourishment, and one need to be very careful that with treatment you don't become more malnourished.
Especially for women who are perimenopausal or menopausal, because they are already predisposed to losing muscle every year. So if you are menopausal and now the drop in estrogen means your muscle is, you're losing muscle and bone density on an annual basis, you're saying going on diet, off diet, on diet, off diet is actually doing more damage than good.
Absolutely. It's even more relevant to senior people. Okay. Not about women alone, even men. You just mentioned about bone health. As we age, our bones become weak. We all know that osteoporosis sets in. The only way that can be avoided in long run is by exercising regularly. So if somebody is 65-year-old, he should be exercising more regularly than his 25-year-old son or daughter. Because he needs exercise more to remain healthy than somebody who is doing it for better biceps or a better abdominal muscles.
Is walking enough exercise?
Not really.
No.
If you can't do anything, then walking is fine. But ultimately, strength training is what really matters, because when it pulls on the bones, when you are doing a strength training, you are pulling the muscles are pulling on the bones. It causes sort of micro fractures, and when they heal it, they make the bone stronger. So osteoporosis can be almost reversed by doing strength training. And that is one of the problems which happens when somebody is 80-year-old and slips in on the bathroom.
Yes.
And has immediately a fracture because there is such a bad osteoporosis. Now, this doesn't happen when the same person would slip at 18 years of age because the bone is strong. Now, we can avoid those by being careful. These are all preventive situations. A lot of awareness has to come in the society because, Everybody says doctors say anything, don't listen to them. We should lead a healthy life. We should eat and enjoy. What is the life if we can't eat these things? That's all good to enjoy a joke, but life is a serious issue. Your family depends on it. Your friends depend on you. One cannot take it lightly.
Doc, the traditional idea of losing weight was go for a walk every morning, or do a certain amount of activity, do some exercise, and that's how you lose weight. What is the correlation between doing exercise and losing weight?
I think it's a most important question in minds of those who have gained weight and who are struggling to lose weight. I'll give you a story. I was at the airport and we were going down by escalator in the security zone, and a family also went down by escalator, but their grandmother was climbing down the steps, struggling because her knees were aching. And I couldn't take it. I went down and I waited till she came and I said, who told you to come? Why you couldn't take escalator? And she said, but ये मेरे बच्चे हैं ना जो बोलते हैं दादी सीढ़ी से चला करो तुम्हारा वजन कम होगा. No, this is so painful to hear. This is a level of ignorance. That lady could have died of a heart attack during that climb. She was in so much pain because of her knee joints. And for this silly or ignorant reason that exercise should be done for weight loss. Exercise, scientifically speaking, has no role in weight loss. If in a gym there is no dietitian, nobody will lose even 1 kg. Because, as I walk on a treadmill at, let's say, a speed of 5.5 and 6, if I'm not running, I'll burn about 250 calories in half an hour. And 250 calories is like half a samosa or a slice of pizza or anything that I eat in a day. So if you are exercising for 1 hour and aggressively exercising, you are probably burning about 400 to 500 calories, which doesn't even count, in the whole scheme of things. So weight loss is mostly by reducing calorie intake and not by exercising aggressive. Weight loss is different thing and health is different thing. Exercise is extremely important for better health. I'm not saying you should not exercise. Everyone should exercise. You should exercise. I should also exercise. Everybody should exercise. A youngster should exercise. Senior citizens should exercise. But it is for leading a healthy life. Exercise makes our bowel move. Exercise makes our heart perform better. That's why it's called cardio. Exercise for many things. Exercise also, as I explained, to build muscles, to give bone strength. So exercise have multiple roles. Exercise is also important for weight maintenance. So whether you do diet, whether you go on GLP-1 or whether you have bariatric surgery, if you want to maintain weight long term, one should exercise. Exercise is the best way to maintain weight. But exercise has practically no role in weight loss. So I think we must have very clear-cut messaging. The problem is somehow in the noise about exercise, by the advertising of by the exercises centers and studios, it's about weight loss. And this is where people have misplaced priorities. They spend 2 hours in a gym in a hope that they will lose weight. If they concentrate little more on what they're eating tonight with their friends, they would probably lose more weight.
We regularly hear these stories, and like we talked about, right, bad news travels much further. Oh, there was this young person, early 40s, late 30s, had a heart attack in the gym. He was a fit guy. He was, regularly playing tennis. He was so good with his exercise. Why does that happen? Why are we hearing so many of these stories now?
This is so unfortunate that, somebody young loses his life, okay, because he probably has a child who is 10-year-old. What about that girl? It's a bad situation. Now, why it is happening? There can be 2 ways to explain it. One is that this person may be exercising regularly but eating unhealthy. Maybe eating chicken fried or fish fried in dinner with alcohol, and So those unhealthy food items get deposited in the arteries and coronaries, and already the coronary arteries are half blocked, and when they put a strain, they end up with a heart attack. So it's not about exercise, also simultaneously eating healthy. And unfortunately, a lot of people who are exercising in gym in their homes, the food is not healthy. We can discuss about food the whole day. The second part is exercising in an unhealthy way. I'm sure all of us have been to gym repeatedly, and we know a treadmill has a device which you put it on your body, so it measures your heart rate. Why the treadmill owners manufacturers have put the device? There is the safe heart rate zone. So when your age is this much, you reduce that many years from 220, and then you should not excess. Your heart rate should not go above 80% of that.
Okay.
So if I'm 66-year-old, I should deduct 66 from 220, and out of that, whatever the number that is remain, I should not be taking my heart rate above 80% of that. So at the moment, my heart rate at this age should not go above 125 or 130 when I'm exercising. Now, nobody monitors it in the gym. Especially the younger people. Even the trainers who are aware of it do not educate their trainees or the mentees. So they are running on a treadmill at 9 and 10 speed without caring where their heart rate goes. Why the heart rate is so important? What is the heart rate? Heart pumps blood, the heart gets emptied. Okay, the blood goes all over the circulation. But when a heart relaxes, the blood supply to the heart gets filled, the coronary artery gets filled. Now, it takes that much time for it to fill. Now, if you are running at a very high heart rate, let's say if your heart rate is 180, it's pumping so fast, the heart itself is not getting its blood supply. It's pumping to supply blood all over the body, but it's not getting its blood supply because in diastole, when the heart is relaxing, it gets the blood supply. It needs that relaxation time between a contraction and relaxation to fill itself up. And if somebody is not doing that, he is likely to get a heart attack at that time. Now, this is a completely avoidable death. If this is happening because of this, there is no way for anybody to know it because nobody
has done that study.
Is monitoring that. But this is a completely avoidable attack. Now, if somebody is exercising for years, gradually our heart rate slows down. So, if I am exercising for 3 consecutive years, my average heart rate, which is like, let's say 80, will come down to around 60 because the heart has an effective pumping.
Your resting heart rate.
My resting heart rate goes down. And even on exercise, my heart rate will not go to 120, it will go to 90 or 100. So those who are exercising for many years on a regular basis, gradually building, they are not likely to have heart attacks. But those who start suddenly within a year or two, they want to run a marathon. That's why you have deaths in marathons also.
Yeah.
Those are the people who are at high risk. And that's very unfortunate because these are the things which must be ingrained in their minds and the trainers must watch for it.
We talked about using exercise to rebuild or retain muscle mass. And you also said the heart is a muscle. How do you make your heart stronger? What exercise makes your heart stronger?
I think cardio.
Okay. So
even walking is good because it gradually builds up your heart muscles. Heart contracts better, contractility. So that's why, the all aerobic exercises are good for heart and lungs, besides for your legs and thighs. So I think that's the only way one can do that.
All right, doctor. Thank you. Thank you so much.